So it is 8:32. Call the meeting to order. Let's do a roll call. Ryan, do you want to start?
Yep, Ryan for Montague here.
Tim Hilchey from Deerfield.
Bruce Bennett, Sunderland.
Noreen P. Shutesbury.
And Megan Tudrin, Greenfield. Okay. This meeting is being recorded by the Board of Health. If any other persons present are doing the same, you must notify the chairperson at this time. Public comment, there will be no discussion or comments that will be entertained unless requested upon by the chairperson or the board of or committee. New business. So the public health nurses have been extremely busy the last couple of weeks. I will just read a little synopsis of each person. So Sarah, she confirmed her poster presentation at the National APHA conference in November. She secured and made resources available for community members such as bug spray, tick remover kits, Narcan medical devices. She started a lending program in Shutesbury and Leverett. So if somebody needed to borrow a walker, they could get that from her, or crutches, things like that. There is a program up here in Greenfield where people can borrow the things, but a lot of residents in Leverett and Shutesbury were having a hard time, getting all the way up here to get the supplies. So she started her own little lending library. She helped support the Brain Health Initiative for a neighborhood dementia support steering committee. She's been posting about heat and UV safety. She's done lots of in-person visits and office visits. She met a new client, and she's been going to the home weekly. She's continuing to work on her published manuscript. She's been submitting it to many nursing journals for approval. It's really hard to get into, though. She's worked on maternal child health and wellness. She's developing a flyer and advertising a program. She wanted to get a VHRC Facebook page, which I thought was a fantastic idea, because that would be one place where we could tell all of our community members, go look for this information so that we could post, tick-borne illnesses are on the rise or whatever. But the city has turned us down because they said that it's
Needs to be monitored.
it needs to be monitored all the time, and it has to be, everything that goes on there has to be recorded or something for open meetings. Yeah, records requests. Yeah. So we cannot get that. I told her that maybe she could ask each individual town if she could make her own thing, like public health nurse page, and maybe that would be allowed in your towns, but the city is not going to allow it. We do have a City of Greenfield page that I've been posting things on. I just put up a tick warning and a West Nile warning on there. I've been using Deerfield now as an unofficial place too. So we're getting some, but the towns that really need it are Leverett and Shutesbury, where there's not a lot of communication, and those are the two towns that we can't service, and unless we can tell everybody to go to the Greenfield City page, but nobody wants to follow that all the time because it doesn't relate to them 99% of the time. Anyway, she's also been preparing flu vaccine reminders and flyers. She's going to work with the school nurses as soon as they come back to see if we can get a flu clinic in Shutesbury. She said that they had a great turnout last time. Actually, I think they were like the highest in the per population in the state for school flu vaccines or something like that, COVID. We partnered with Stop and Shop for the city of Greenfield, so we can have them come in and do flu clinics for us. They don't charge for the clinics. They do take people's insurance. They said if there's one or two folks that don't have insurance, they won't bill us for it, and they won't bill the patient, which I think is great. But if there's a large number, then they would have to reconsider. And Montague is partnering with Walgreens. Robin had already set that up, and they're going to do some clinics there. Anne, she's been doing weekly visits to the South County Senior Center. She has weekly office hours in Sunderland. She's met with Caitlin Pettingill, who's the head nurse pretty much of the DPH, and Ann Mistavar, who is the training coordinator for the DPH for our region. They had some good ideas about home visiting programs for postpartum women. That's one of the things that Safe 2.0 is now saying that we have to address in some manner is maternal child welfare. So she's working on starting a program there. She met with Linda Jablonski, who used to be the nurse manager at the birthplace in Greenfield. She's been working with the Western Mass Perinatal Coalition. So hopefully she can get something up and running soon. She is starting to plan for fall flu clinics. She just put out a message to all of us to see if we can host a clinic we want to do the South Deerfield Fire Station again for an over 65 flu clinic because we got a lot of people that came last year. I think we had 66 or something like that, which is a lot for just a couple hours. So we'd like to do that. And that one would be run by us where we would use the flu clinics because we purchased 100 high dose flu shots. So we're hoping that we can get those out. We did put out a kind of a informational thing to the senior centers. I don't know if the senior centers have posted yet, but just warning, not warning, but telling people the right time to get the flu shot is mid-September to October. Because last year we had an issue where people were getting their flu shots in August as soon as they came out. Doctors' offices really pushed them to come out at that time because they want to make the money to get to get reimbursed or, that's what I'm guessing is the reason, but the best time to get it is mid-September to October, so that it lasts through peak flu season. So we just put out an informational thing on that. What else can I tell you? Robin, I'm so impressed with right now. I mean, I'm impressed with everybody, but Robin wrote a letter to Joe Comerford because we have had people that have not been tested for tick-borne diseases when they go to their PCP's office. They'll be like, oh, you don't have a rash, you don't need a test. We're hearing that kind of story over and over again. And then 2 weeks later, the person's in the hospital, for several days at a time because they now have anaplasmosis and nobody treated them. We had a horrific story about one person in Greenfield who their PCP, they had known tick bites, their PCP wouldn't test them, went to the hospital 2 weeks later because they just continued to get worse. And the doctor in the ER didn't prescribe medications, but did do a test. Then I called probably 4 days later when the results came into Maven. I called the hospital and nobody had notified the patient still. So this was now, we were out like 3 weeks or so that she was incredibly sick and she had no idea and had not been started on medication. So that kind of triggered Robin to make a lot of phone calls because she's a shaker and a mover. So Joe Comerford talked to the head epidemiologist and veterinarian medicine person at the DPH. The DPH then went out and sent a letter to every provider in Massachusetts telling them what the proper protocols were. So we were incredibly impressed with that. I don't have her her thing up here, but she's been working with the Greenfield Savings Bank. She's been hosting a lot of programs there, suicide prevention program. She's been working with the veterans. She has been working with the Brick House again, providing programming, setting up the flu clinics. And I think one of those is also going to be at the Greenfield Savings Bank. She said that they've been amazing to work with. I would have never thought to go to a bank to do all my public health nursing, but it is absolutely working.
Part of it is they do like a health fair there, so they're partnered with the WOW bus as well,
Yeah.
which is through Bay State. So yeah, they're pretty good place for those sorts of things. If you guys ever need to do tabling, the community fair is great for tabling. We've had our other public health nurse go there as well.
Great. So I think that's probably the biggest things from the nurses. Discuss the future of the Valley Health Regional Collaborative.
Megan,
So-
may I just ask
Yeah.
a quick question, clinical question? What is the test for tick-borne illness? Is it a blood test?
It is a blood test.
Okay.
And so there is some people just some providers just do a Lyme test, but we live in a huge tick disease area and really they need to do what they call a full tick panel, which includes babesiosis and anaplasmosis.
Thank you.
Tim, you have a question?
Actually, I just wanted to say, we're very pleased that Cindy Majewski is back in the office and wanted to thank the nurses for their coverage while she was out. She's still not fully able to use her hand that she had a bad break in, but she's excited to be back as well. So anyway, thank you.
Yes, Cindy is amazing. We are really happy to work with her. And we bought her a very special blood pressure cuff so that she could do blood pressures with just a push of a button. And it's medical quality. It's like a $600 blood pressure cuff. And we got it in through last fiscal year, so we didn't have to
Okay.
give that money back.
Great.
And so we did meet, Mike and I met with the mayor about 2 weeks ago or so, and the city of Greenfield is on board with continuing the VHRC when the grant is done, if all of you are interested in doing that. We thought maybe we could try to come up with some ideas for funding. You know, I know that right now each individual town has their own budgets, and maybe we could somehow, whatever you're spending now, we could kind of form into one big pool of money. Yeah. And keep Corey on and the nurses on. Plus we're assuming that the state is also going to give us a lot more money when this runs out, if it even technically runs out. But that's just something that we want you to think about, whether you want to continue with us. And, you know, I know in Sunderland and Leverett, you're kind of at a position where you don't really have anybody in there right now, and maybe the person that you were going to have may or may not come back. So if you choose not to fill that position, that would be okay with us, because we would never want somebody to lose their job. So if you have somebody in the position, we would never want them to, you know, to have to be laid off or whatever. You know, that's definitely not something that's on our radar. But if you don't fill the position, if somebody leaves, then maybe it's something that we can take over, and we're happy to help until you know, through as long as you need us, pretty much. What else was I? Oh, so the one thing is we have to watch out for supplanting. So if you have the money in your budget and you don't have a position filled, you are allowed to keep it empty as long as you keep that money for public health. So you could put it in, so say you're not paying an inspector right now, you could put that money into a health department fund, just keep it there. As long as you don't spend it or move it back to the general fund at the end of the fiscal year, then it's not supplanting. And then you could use it, you know, say in 2 years if you want to, you know, have the inspector do more hours or whatever.
So that's what I had a question with Shutesbury. What was Claudia? Was she like a third party contractor, or was she like a Shutesbury employee?
Shutesbury, Claudia we have money in our budget, and that's how we paid for Shutesbury. However, it went through the district. There was a separate health district that was formulated with Irving, and they're in the process of deciding what they want to do with the health district. But we've already talked about it in our board, Mike, and we're very interested in continuing with this group.
Okay.
I can't say I've talked to my.
Go ahead, Ryan.
I was just gonna say, I haven't talked to like the, you know, the powers that be in the town yet, so I'm not sure what my board feels like, but I know in general, you know, the shared services have really been helpful for, I think, our community and all the other ones. Since it's funded through 2027 currently, we're basically looking at like, you know, is there going to be legislation passed before FY28 that creates further funding for this? And no one knows the answer to that. But what I would say from, you know, like from Montague's side, you know, we have a decent sized budget compared to some of the smaller communities. So if we were to have to fund like some sort of service like that, I'm imagining like we could probably incorporate like maybe a line item to pay for like membership or something like that. I have a hard time imagining that the town would want to pool its budget into one collective budget and not retain any control over those funds, but I could see them like wanting to pay for like membership services.
Yeah. Yep. That makes sense.
Yeah, Sunderland would be very interested in continuing the services. We've been happy with what we're getting so far, and I think it's a good idea. And I hope the state does refund it.
Yes.
Yeah, and I'll just third that having knowledge about what would the cost be if we don't get additional funding. Obviously, we're through 2027, so we have some time, but as we think about this going forward, 9 months out, we would like to say, okay, this is what we anticipate the cost to be if we don't have X funding. Because yeah, it's a valuable resource. Ned Savitsky is on family leave at the moment because his partner had a heart transplant. So this will be a valuable coverage for us. And I can anticipate any number of situations where the HRC would be invaluable. So
On my next person.
Okay, Mike wants to talk.
So yeah, since I'm covering all of you right now, I just wanted to get in here and kind of get just kind of some specifics on what you want me to do with some of these septic work. So some people are sending me plans now. So I just need to know where you want me to send those plans. You want me to just forward them on to you guys at the Board of Health after I review them, just give you like an email saying they're okay. Because I believe I have one today I gotta go look at in Shutesbury. That's a final, but I haven't seen the plan.
That's a tough
I know-
discussion, Mike.
Yeah, I mean, I know what I'm looking at, but like it's hard if I don't have the plan on me, or at least to be able to look up to see if there's any funny things that they needed to do. So I don't mind if they send plans to me. I'm super fine with forwarding them on to you guys. So that was my first question. If you guys just, think about that and let me know.
Can I answer that for Shutesbury, which will
Yep.
help you right away? You can just call or email Kat Hilton directly, and she will get back in touch with you. I'm pretty sure same day. She's our chair of the Board of Health, and she's also our clerk, and she's been on the board for 30 years. She knows everything and everyone.
Okay, that works.
Do you
Mike,
have her contact information?
I can give it to him.
Okay, great.
Mike, the same goes for me, for Sunderland. You can just call me or send me an email. You should be getting one today for Montague Road that has some issues with it, and I can call you and talk to you about that later.
I did. I just got that one from Alan. So I
From-
just got that one today, so I'll be able to review that before the end of the week.
Yeah, from Alan Weiss?
Yeah,
Yeah, okay, yeah.
So forgive my
then-
ignorance, but what plans are you talking about and
Septic
what
plans.
service are you
So-
providing?
if someone puts it, so right now I've just been covering septic. So if someone's doing a new septic repair in Deerfield and obviously Ned, also Title Fives too, so I've been doing the Title Fives. If you do a Title Five viewing, the plans are specific just for the septic repairs or for a new system. So it's just the plan for the entire system needs to be reviewed. I believe all of them will all come to you for permitting and the fees and everything. I have no problem reminding people when I go out that they need to talk with you and get fees, because sometimes they think that they pay the contractor and they're all good, but obviously there's fees associated with the towns as well. So I will also remind people when I go out in any of your towns that they need to make sure that they pay those fees directly to you guys.
Right, so Ned is based in our building department and Amy Hahn is sort of like the administrative overseer. She's also the building department. She handles building, electrical, plumbing, Title V. And if she's not the right person, she would know who to refer to. So do you have her contact information? If not, I'll provide it to Megan and she can pass it along. And I don't
Okay.
know that I have your email, but
Yeah, I mean, whatever you need me to do while Ned's gone, that's fine. Just let me know. I'm here.
great.
And yeah, Sunderland seems to be going fine, right, Bruce? You haven't had any issues, nothing come up?
No, I do have one guy I'm dealing with right now. I'll call you later and talk to you about that later.
Okay. Shutesbury seems fine. I haven't, just a couple Title Fives, and then I think I had 2 finals up there, but they were both fine. The other thing is when I issue my certificate of compliance. So I've been trying to move it along because you guys don't want to get involved in all that paperwork. So at the end of everything, usually at the end of a final system or a repair, they need that certificate to sell the house or move in or whatever, they just need that certificate. Usually I bring it when I do my final inspection, like I'll bring one today. I sign it, they sign it, and then I tell them to scan it and send it to you guys. So if you don't get anything that's a scanned state document with a bunch of signatures, let me know. Because I gotta remind them that you have a copy, because you guys need that copy. I can usually bring two, so what I'll do honestly from now on, I'll bring two copies. If they're there, I'll have them sign both. I'll bring one back here and scan it to you if I can. Because sometimes I just don't trust that they're gonna get it to you, so it'd be better if I just do it.
And that's scanned to our Board of Health Department.
Yeah,
correct?
I'll scan it to you
Yeah,
guys.
that's
Board
good,
of Health. Yeah.
good.
And Mike, I'm sorry about the septic inquiry you got for us. They were just confused.
And then what'd he say? They were just mowing the lawn and putting flags in?
Yeah, I don't know. It's always something with that place. If I need something for septic, I'll make sure to reach out though, for sure.
Okay, he reached out to me and it didn't spark in my head right away. I'm like, what address is this? And then I was like, oh yeah. And then he's like, well, they're digging. And then he comes back to you and he's like, well, they're just mowing the lawn.
Yeah, they seem to be under the impression that Greenfield has just taken over all septic for that. But it's more like task based. Like if we need you to go out, we'll reach out and give you some time.
Yeah, that's fine. That's
We'll
I figured you
blindside
had
you.
it over there. I figured you were fine over there. I was just trying to figure out the smaller ones.
No worries.
Leverett not here yet, no. So the next is Ileana has left, which is really, really sad because she was amazing. We have now been assigned Ron O'Connor, who's like pretty high up in the DPH, so he's much, much harder to get in touch with. Just even the request, I think he only checks the thing once a week, and Ileana used to get back to us right away, so it's a little bit harder. But he did assign us a subject matter expert named Caitlin Roan. Caitlin hopefully will be able to help us get that contractor that we were looking for to upgrade some of our regulations. I did send her a copy of Leverett's Title V's that they were specifically asking for help with, but if they could get us somebody, that would be fantastic.
Do we know if they're going to replace Ron at some point? Like, is he just doing this as an interim?
I would assume so. They haven't said that to me, but I
I'm
would
wondering
assume
if it's because of the
can't.
hiring freeze.
Oh,
There's an
maybe.
executive office hiring freeze right now at the state, so they can't post positions.
Oh, that would make sense because I can't imagine him being able to handle this on top of everything else he does.
The good news is that I don't know, is it Caitlin or Katie Roan?
Her real name is Caitlin, but it looks like she signs her email Katie.
Oh, okay. Well, anyway, she's very good, I think, though. So that's
Perfect.
yeah.
Great. So hopefully she can help us find somebody that we can hire as a contractor. Let's see. The FY26 budget was approved. The VHRC, oh no, I already said that one. For the 10th. Okay, so one of the things in our work plan, one of the two things that we have is tobacco work. So the VHRC can start conducting inspections of tobacco retailers in towns that are not part of the Pioneer Valley Tobacco Control District. We're going to take some training classes before we do that because we're not exactly sure what to do. Ryan's our expert. We probably could have Ryan teach us a class, but there are some things on MAHB. We've emailed them and asked them to set up some training for us so that we know exactly what we're supposed to be doing.
Have you talked to the Massachusetts Tobacco Control Program with like Sarah McCulligan?
She's the person that we emailed. Yes.
Okay,
And then
great.
there was somebody else's name on the list too. So we emailed both of them. This was just a couple days ago, so we haven't heard back yet.
They do some really good training, so I would think that they would be able to offer like at least like a Zoom or something.
Yeah. Okay, perfect. VHRC. So we do have a halftime position posted for the VHRC inspector. We have one applicant that we are interviewing today at 1 o'clock. The resume looks decent, but that's the only one that we've had so far. I will give you an update after we do the interviews. Corey has been out doing 1 million inspections. He's got Greenfield totally up to date on food inspections. He's been working a ton in Sunderland, getting them up to date. He's gone out and done second inspections. Shutesbury, you don't have any, Noreen, you don't have any food establishments, right?
No. Well, we have the AC, which gets inspected once a year, of course.
Oh, the
AC
athletic.
Cup, that's it.
Okay, that was on his list, but I wanted to check with you before I sent him out there. Is that
Yes, they
that's
do
absolutely-
dinners regularly up there, so they should definitely be inspected. And they've had some concerns identified in the past. That in the school, of course.
Okay, perfect. Tim, do you have anything that you want us to be doing while Ned is out? Like, do you have any food trucks or any? I haven't heard anything or Title V's on your books.
Yeah, so Ned's situation, has developed recently, and he's a relatively new employee, so we had to create a bank of days that he could be away by other employees donating to that. So
Oh.
I'm just about to press the button on an email to you, and I will also copy Amy Hahn, who was the woman I was referencing. So maybe she can coordinate with you about things that we're lacking coverage on.
Okay, perfect.
Does that make sense?
Yeah, absolutely. Yep, because we definitely can. And we can do some of the like routine ones now because Corey is just about caught up with everything that was on our radar. So if you need help just getting your 6-month food inspections done, he can absolutely start doing those for you.
Okay.
And then
will,
Ned
put
won't
that
come
in the
back to a
email, too.
huge pile of stuff on his desk.
All right, good. Thank you.
Megan,
Yes.
I'd just like to say that the feedback I've got from some of our food establishments have been positive.
Great. So I think that was all that was on the agenda. Does anybody else have anything that I missed or that?
I'd just like to say that Corey has also been really great in Montague. Like he handled an event for us this weekend that I wasn't able to do and went really smoothly.
All right, sounds good. All right. Meeting will, or do I have a motion to adjourn the meeting?
Can I just ask one quick question first of Mike? I just want to go over. So you're scanning the septic results into your records, Mike, and then you're going to email copies to our boards of health. Is that how it's going to work?
So I can email it to you. So if the people are on site, well, what happens is if the people are on site, I can usually get them to sign it and I'm good. But the problem is getting the installer and the engineer on site at the same time sometimes is difficult. So usually they'll reach out to me. I'll get an email from whoever's there, or I'll try to get an email from the installer or the engineer. I'll send them a signed COC and then they will send it back to me. But I also do tell them to send it to you as well. But I'll send them to you just as a backup. So even if you get 2, it's better than not getting any.
Yeah, that would be great. That's what we're accustomed to. And then we know that it's final and we vote on it in the board. So that would be helpful. Thank you for the clarification, Mike. I appreciate it.
Yep, no problem.
Now I move for.
Oops, sorry.
Go ahead.
I have started a file cabinet here for each of your towns. So
Oh,
like
that's nice.
for Bruce, I have all of the copies of the food inspections here. I know that he drops them off at the town hall there as well.
Yes.
But I do have a backup copy here for everything that we will do.
Okay, thank you.
Do we need to set a meeting date?
Yes, that would be great. Let's do that. S- So the next one that was on the calendar, because we used to do every third Thursday, is the 14th. Does that work for everyone?
I'm going to be going
That's
to
September?
Is that August? Should it be
Oh,
the 21st?
I am on the wrong month. That obviously doesn't work for anybody. The next one would be September 18th, I think, and that one does, oh, actually September 11th, does that work?
Mhm.
So we'll skip August.
Oh, wait, oh, sorry, Tim, I am totally not knowing what I'm doing. No, August 14th, we don't want to skip August. Does August 14th work?
Would we be able to push it back a week just because I'm going to DPH in Boston that day?
Yep. 21st?
21st seems good to me.
Seems good to me right now.
Yes, that's good.
Okay, let's do it. The 21st at 8:30 a.m. BHRC.
Thank you for the flexibility.
Yeah, no worries.
Great.
All right, motion to adjourn.
Made.
Second.
All right. Thanks so much, everyone. Bye-bye.
Thank
See
you.
ya. Bye-bye.
Bye.